Hi, Mrs. Johnson. I'm Betty, your nurse. I'm back. You remember earlier I talked to you that the doctor has ordered nasogastric tube to be inserted for tube feeding. Well, I have the supplies now. Okay. So what I'm going to do is I'm going to first of all measure the tube. How long I have to insert in. So I'm going to measure it from your nose to the tip of your ear to the xiphoid process. Okay, I'll do that first. Okay, so I have the supplies for the nasogastric tube here. I have the pair of gloves, and it doesn't have to be sterile. I have, as you see, I already opened the NG tube. Usually we use number 16, and I have that. And I have the Toomey syringe, 60 milliliter. I have the tape to tape it once the tube is in so it doesn't come out. I have the water-soluble base lubricant, and I have some water, so when I'm inserting the tube, so the patient drinks the water, it's easier to go in. But you have to remember the patient is allowed or not allowed to drink water. So in case the patient is not allowed to drink any water, you can just lubricate the tip of the NG and just insert like that. And then I have a little cup. So once I have inserted the NG tube, I withdraw some gastric fluid and I check the pH. Now the pH, if it's 4.1, that means it's in the right place in the stomach. It's not in the lungs, so that's what that is for. I also have the stethoscope to check if the tube is in place. I'll be listening for gurgling sound once I put air into the stomach. And I have something to protect the bed. Okay, so before I do anything, the first thing I need to do is check and assess the abdomen. Feel it, there's no pain. And I have bowel sounds. Is it hypoactive bowel sound, hyperactive bowel sounds? Patient have any pain? Do I feel any nodules? So you always want to assess the stomach first. Okay, Mrs. Johnson, I'm going to just check your tummy and listen for bowel sounds. Okay, so I am just observing. Okay, it looks symmetrical. It doesn't look distended. And it's nice and soft. I don't feel any nodules. Okay, so now I'm going to listen for bowel sounds. Okay, Mrs. Johnson, my stethoscope might be a little cold, so I'm going to warm it up. Okay, I want to listen to bowel sound all 4 quadrants. You got good bowel sound. They're not hypoactive and they're not hyperactive. They're good bowel sounds. Okay, so now I want to do is I want to measure my NG tube, how much tube I'm going to insert through her nose to the stomach. Okay, Mrs. Johnson, I'm going to measure the tube from the tip of your nose to the earlobe and then up to the xiphoid process. Okay, so tip of the nose to the tip to the earlobe and to the xiphoid process. So this is what I measure. This is how much NG tube I'm going to insert. So as you can see, I already taped it. So it should end up, up to the nose here. Okay. All right. So I have all my supply ready, and what I want to do is lubricate the NG now. Just the tip is fine. Okay, so I can cover her. And now, I got to make sure that I position Mrs. Johnson, 90 degree before I insert the tube. So I'm going to put the head of the bed up. Mrs. Johnson, I'm just putting your head of the bed up 90 degrees. It has to be high when I insert your tube. Okay, that's pretty good. Okay, I'm going to put my gloves on. Okay, and then you hold your tube in your hand. You want to hold this so it's not falling everywhere. Okay. I'm going to lubricate just the tip of the NG tube. And I have my water ready. Okay, Mrs. Johnson, as I'm inserting the tube, I want you to hold a cup of water and drink the water, because you're allowed to drink water, and just for the nasogastric tube, and it'll make it easier to go in. Okay? All right, here we go. Oh, before I insert it, I just want to make sure, in the past, you have any problem with your nose, like one side is blocked or something, and because I don't want to use that side, I want to use the side which is not usually blocked, and the tube will go easier. Oh, okay, you have no problems? Okay, I can use any side? Okay. So here, you hold a cup of water and drink it as I insert the tube. Okay, here we go. I know it's not comfortable. Drink some more. Drink your water. Good, good, good. You're doing good. I know it's not comfortable. We're almost done. Almost done. Oh, you did really good. Very good. Okay, once the tube is in, the nasogastric tube, you got to make sure that you don't let go of it, because if you let go of it, it's going to come out. So that's very important that you get a good hold, and just hold like that. Okay, so now the first thing I'm going to do is I'm going to listen to the bowel sounds. So you could put 15 to 30 cc some air, and what you're going to do is you're going to hear right here, as I inject the air, you're going to listen for gurgling sound. Okay, right about there. Okay. And I'm going to inject some air, and I'm listening for gurgling sound. If you have gurgling sound, that means the tube is in, and I could hear the gurgling sound really good. So the tube is in. Okay, that's good. Okay, and the other thing you can do is you can, so that's one way of checking that the tube is in the stomach. You put air in and hear and gurgle. The other thing you can do is you can withdraw some fluid from the stomach and test that for pH. So I'm going to put it in the little cup, the gastric content, and I'm going to check with the strip to check the pH. Now, if the pH, like I said earlier, is 4.1, that means it's in the stomach. Oh yeah, the pH is 4.1, so the NG tube is in the right place in the stomach. Okay, so you always want to pinch the tube so the air doesn't go in. And for now, I'm just going to have, the Toomey syringe there. Okay. Actually, I forgot to put this in, so I don't drop something on the bed. Because if you put the, sometimes you take the Toomey syringe out and some liquid might fall on the bed. So I should have done that before. Anyway, so now I want to make sure the NG tube is in. I need to tape it really good, otherwise it's going to fall out. And I can also, what I can do is I can just use a safety pin and put it right here so it doesn't pull, as the patient moving around. All right? Okay. So I'm going to get my tape. Here's my tape. So I just need a small piece of paper, small piece of tape, like this big, okay? And then I put it here like that. Okay, we're almost done, Mrs. Johnson. Okay, I'm just taping it now. Okay, so you tape it like one this way and the other this way. There you go. Now it's not going anywhere. Now the other thing you have to make sure is the organization you work for, they might have a special a sticker which will hold the NG tube. So if you don't have that, you can just use the tape like I did. And that's it. That's how you insert the nasogastric tube. And before you leave the room, you got to make sure that you know, you have something here, it's closed, so gastric juice don't come onto that, okay? So I put this thing here. Okay, very good. Mrs. Johnson, you did really good. So I'll be back with your tube feeding. The doctor has ordered Gravity 1.2, and so I'll be back, okay? Thank you.